And welcome to another sploofic episode of Healthcare Achievers Talk Show. Here to have a juicy conversation with my amazing guest on the show on Healthcare Achievers Talk Show live on Wash 94.9 FM, the Fun Health Radio. So welcome to the show. I remain Mary Zoreawala, aka Roya the Radio Diva, aka the Media Nurse, aka the Talk Goddess. Some choose to call me the Queen of Microphone. You're welcome to the show. Achievers Talk Show is that one major, very important show that you don't want to miss every week. It is a program where we have conversations with achievers in the healthcare industry, people who are really making us proud in the field, people who are making impact in the field of healthcare. We have doctors, we have nurses, we have health researchers, we have pharmacists, we have lab scientists, so many of them like that are making us proud in the healthcare industry. Like I always say, that we will be the ones to blow our trumpets ourselves. Let's blow our trumpet. Let the world know that we are doing amazing here in Nigeria, and our healthcare industry no be moi no be shere. Like our professionals are really doing an amazing job. So today I have someone in the studio with me who is our achiever of the week. Oh my God, yeah, our achiever of the week. A very beautiful woman, amazing woman, smooth talker. If you see fineness, come and see cuteness, come and see intelligence, brainy, cerebral, kilo day, organidy. This woman is someone who inspires me a lot, and I know that you're going to learn a lot from her on the show today. She's going to be telling us her story, sharing her journey to success, sharing her career journey with us so far. She's a nurse. She does something really very spectacular. This is the first time I have an advocate for children born with cleft lip and cleft palate on my show. So I am so honored to have her here today. I am talking about Oluwanifemi Ayelomi. She is an assistant chief dental nursing officer at a prestigious federal hospital in Nigeria with over 15 years working experience. A registered nurse, a registered dental oral health nurse, and a highly motivated professional with experience and progressive learning in dental nursing and extensive involvement in cleft lip and palate care. She's also a current volunteer for NGOs such as Smile Train, Help My Pikin, and Real Visionaries Initiative. She's a public speaker who has presented in conferences, seminars, various outreaches. She backed a BSc in Business Administration at University of Lagos, and she is a serial entrepreneur who deals with clothes branding. So when you're talking about somebody that is an all-rounder, you look for her in this place, you find her there. You check this place, she's there. You check that place, her shadow is still there. Come on, give it up for my guest on the show today, Oluwanifemi Ayelomi. Good afternoon, Oluwanifemi Ayelomi. You're welcome on Healthcare Achievers Talk Show. Good girl. See the way she just smiling. Even her smile said is this.
Good afternoon. Thank you so much for all the accolades. I'm actually blushing here.
Like you're blown away.
Yes, I'm so blown away.
Please be blown away, but remain in the studio for the next 1 hour.
Thank you so much. Thank you so much for having me. I feel so privileged. I feel so honored to be here today.
Oh, it's so nice to have you on the show. And I must say you're so beautiful.
Thank
and
you.
your profile is quite inspiring, Yeah, so let's talk about you being a nurse. How did this nursing journey start? That at some point you went to do a degree in business administration. Why, if I may ask? So let's start from you being a nurse and where you started from and where you are today. Yeah.
Okay, so my journey is quite interesting.
Okay, I love to hear it.
It's very, very interesting.
Hit me.
So I've always wanted to be a nurse.
Yeah.
And so I schooled in Ondo State. So my first school, after secondary school, series of JAM and then School of Nursing. Then I couldn't get my admission to School of Nursing at that time. So I went to the School of Health Technology.
Okay.
So School of Health Technology train dental surgery technicians.
Okay.
So they assist, they work with the dentists,
okay.
actually. So, of course, everybody, we just believe that, okay, we work in the hospital setting and all of that. And just as I always say, there's always a plan. There's always God's plan, actually. So, I find myself there. So, that means I have to work in the community of dentistry.
Mm.
And then afterwards, I finished that and I felt like, okay, I have more. I carry more. I want to do more. So I went into the University of Lagos. So I had my BSc in administration. For the BSc in administration, it was just a quest to do more, to get more.
You know, for someone, sorry to cut you short, for someone who was already a dental technician,
yes,
then
yes,
why would you now swap from being a dental technician to studying
administration? Okay, so
administration.
So what for me, it was quest for knowledge, as I said.
Okay, quest for knowledge.
And also, you know, at that time I did not have the mentors that I have today. So, and from what I heard, as a business administrator, you can spread your wings. Okay. You have tentacles. You can explore. So I wanted space to be able to move. And so I took that. And of course, it's a degree. I wanted a degree. So I went for that. Now, my passion for business administration is still going to sweep me into some administrative role in nursing, which I actually love more. I love that. So, of course, it is not a waste.
Yeah, it is.
Then afterwards, I started working in the tertiary institution, one of the foremost tertiary institution in Nigeria that is located in Lagos. That's where I work. So I'm not gonna just because I'm not representing my hospital. That's why I'm not.
So that's why you're not mentioning. It's fine.
So so when I started working there, and then I have the opportunity, my department, I have the opportunity of meeting with these people. I work in the surgery department, so I was able to meet with people. I see how they move, and then I now say, you know, because you're in surgery, you see a lot of cases, a lot of things that people do not even know about. And then because many people neglect, you know, their oral health. Because they just believe that when you go to see the dentist, the next thing that is going to happen is that you're going to have your tooth removed. So because I'm in that line, I try to grow. And then when I started, I have the opportunity to be involved with children, with the children that have cleft and palate. Then I pick it up from there. I had passion for it. And so why not? Then I pursued my... in the nursing line, became a registered nurse.
So at what point did you go back to study nursing?
All the way, I never stopped, actually.
Oh, wow.
I never stopped. So after my BSc in business administration, of course, I never stopped. Aside from that, I do a lot of other things. I'm involved in research. I also do some other things, nasoendoscopy for children that are born with cleft palate. I also offer speech therapy for children that are born with cleft lip and palate. So I never stopped reading, growing, expanding. It's just that the one that I can say, okay, this is a degree. That's what I've mentioned. So the opportunities came and I grabbed them. To the glory of God.
Hallelujah. So I love what you're doing with cleft lip and cleft palate advocacy. I've actually met dental health nurses, but I've not really met the one that will say, oh, I am advocating for cleft lip, cleft palate. So where did that start from for you? How did you find yourself in that space? Let me pick you up from there.
So my passion for cleft lip and palate children grew when I started getting the exposure to the children. So for me, the passion came when I had my first child. I'm a mother of two. Okay. And so, and at that time, my baby wasn't, I tell this story all the time, so my baby wasn't so big. And of course, you can see me, I'm a very chubby lady. So, and then I got all the comments like, she's a nurse, she's supposed to know what to do, supposed to take care of a child and all of those things. So I felt really bad. At the point I was withdrawn, almost going into depression before I could snap back and say, okay, this is my child. I have to do all I have to do. So then I get exposed to children that are born with cleft lip and palate, and then my heart goes out to their parents, especially their mothers. I know that in this part of the world, anything that happens that is not going well, in quotes, it is usually accrued to the mother. So I see the... So women are always at the receiving end. Yes,
I just tire.
Most of the time, the women are at the receiving end.
You know.
I was able to feel what they are feeling because I told myself if I had a child that doesn't even have any abnormality, and I felt the way I felt, so I can relate with those, with the parents, with the mothers, how they must feel having a child that is born with cleft lip and palate. And then it is even more emotional when these people are having their child for the first time. That's the first child that they have, and they are not even aware that there's a condition called cleft lip and palate. While they are pregnant, they have envisioned their child to look like, okay, my husband, I like the eyes, my grandmother, I love the set of teeth and all of those things, and you're just hoping that you're going to have a child that looks like that, and then boom, you have a child and discover that the child has cleft lip, especially cleft lip and also cleft palate. Then I can imagine how they feel. So many people do not even know that cleft lip and palate can be repaired. So many people endanger the life of those children just because they are not aware. They don't even know that it can be repaired, and many people feel like it's a curse. They feel like there's a lot of myths, a lot of belief that surrounds the birth of children with cleft lip and palate. So they just feel like it's a taboo. The child must be a god, is a reincarnation. The child must be because I did something wrong. Because some people even think that is a reward of the evil that they have done or that their forefathers have done. At a point we had someone coming to the hospital, and she said that our own sibling told her that child was is an ancient man that had gone to war, fought, and then died at war with that cut on the lip, and then the child came back.
That's quite a story.
So you cannot even imagine the things that people say about these children. Some people throw them away, some people force feed them, because one of the challenges that they have is feeding, even either the lip or with the palate. So I feel a need to speak on behalf of those children so that they can have their life. The parents that actually do not know anything about this, and then they find themselves in this situation and they don't know what to do. And also to advocate for the fact that they can live their life. It is repairable and it is not a curse. So that is where I got that.
I understand that when it gets to that point that a child cannot feed well, the nutritional deficiency comes in for that child. There is failure to thrive, and you understand. So developmental milestone will definitely be retarded, and so many things just come with it. So do we actually have mortality rate with that? Do children actually really die of this condition?
Yes. So I can tell you for a fact that, because of course from the profile that you read, I'm a part of I've been opportune to be a part of the research team member, and from what I've known so far, nutrition is one of the basic challenge that we have with children that are born with cleft lip and palate, because the parents really need to be taught how to do it, because even for a first-time mom, you need to be taught on how to breastfeed well, to see that the baby is latching well, the lip is covering, all of those things, the sitting position and all of that. So now for a child that has a challenge of a lip cut. Also, okay, so for some people that are wondering what cleft lip and palate is, I think I should briefly say that cleft is just, for every other person that is listening, is just an opening.
It's an opening.
So cleft lip can be seen on the lip, obviously. So it can be on one side of the lip or on the two sides. So when you see them on one side, it's just like a cut on one side of the lip, and then if it's on the two sides like this, and then you can see there will be a bulge that comes out. So for somebody that has not seen that kind of a thing before, I agree, it can be a little scary. So that's why we are here.
It is scary, actually. I've seen one. And
this
why is this baby like this?
Saying that it is to every other person, it might look like a big deal, but like I said in one of my YouTube videos, now waiting to get solution might be problem. Anything will get solution, na challenge. You will feel overcome.
So I like that.
So that's it for me. And so for me, when I discovered that there is a cure in such that it can be repaired, which many people are not aware of. And then that's why we are out there. So for the cleft lip, it appears on both sides of the lip. And for the cleft palate, until a child opens her mouth or his mouth, you might not be able to see, because the palate is at the roof of the mouth. So when they open, you see the hole there. So some people will not have the lip, but they have the palate.
So a child that has the cleft palate, the lip can actually look normal.
Yes.
Wow.
So there's cleft lip, there's cleft palate. A child can have cleft lip and cleft palate
at the same time.
Yes. And some can have only cleft lip, while some can have only cleft palate.
Okay.
So we need to know this. So if someone has a cleft lip, it's visible. It's easy to identify. Or someone can have a cleft palate and you're not even aware. We've seen children
even the mother will not be aware.
Yes.
Wow.
We've seen children that are about 7 years come to the clinic and they just get to know when the child is 7 years that there is a cleft palate. So when they are feed, one of the things that you are going to see with a child that has cleft palate is that when they feed, the food comes out from their nose. So when they just feed these children, they just feel like, normally a child will regurgitate.
Yes.
Bring out, they will say maybe the baby is too full. Many people don't look that closely. So now that we are creating this awareness, we want to even tell people to check their babies. The same way you check their nails, check their genitals, you want to also check their mouths. When you have seen the lip, when the baby cries or tap the baby, let them open their mouth, check. So that if there's anything, there can be an intervention as soon as possible. So for the lip, one of the major challenges, even for the palate, feeding, the lip would not come together enough on the breast
for the baby to suck.
Because because there is a break.
Definitely.
So we will have to encourage the mother to sit a baby at a position of about 45 degrees. So the baby's bum is on the palm, while is on the elbow, while the head is close to the shoulder, so that the baby can be like in a sitting position. Then the mother is advised to express. So you don't just put the breast in the baby's mouth,
waiting for the baby to suck, because the sucking reflex might not
it's
really
going to be reduced.
Yes, of course the grip will be reduced, of course.
And so to you feel like this baby has eaten, and baby keeps crying. You've thought I fed this baby 5 minutes ago, 10 minutes ago, but the baby is still crying. So the baby is not latching well. Baby is not getting enough milk. The baby will not be able to grow. Immunity will be low. Baby won't, a lot of things are happening. You won't even have rest because baby is not even resting. Baby is in distress. And if baby doesn't feed well, then there is tendency for malnourished. Then infections can come in. Some people, a lot of things happen actually. A lot of things happen. Then when it is the palate, you have to be very careful. In fact, the feeding part for the palate is even more important for the mother, caregiver, to be aware of how to feed, because there is tendency for aspiration.
True.
So when there is aspiration, that means the airway is at risk.
That's even a bigger problem, if you ask me. It's a bigger
problem.
Yes.
It's a bigger problem. So that is why we are advocating. Check the babies when they are born. When you have discovered that there is a cleft palate, we will teach you how to feed them. For some people that cannot feed directly through the breast, for some reasons, some parents don't lactate immediately. Some mothers don't lactate immediately
after childbirth. That's
so
true.
You are advised they advise them to express into a bottle. They have a special bottle.
Oh, there is a special bottle for babies.
Yes,
wow.
Babies that are born with cleft palate. There is a special bottle. So the mouth of the bottle is longer compared to the normal feeding bottle.
Okay.
Some of them come like a spoon at the end of that, the head of the feeding bottle, so that when you sit the baby, you are the one, the other part of it is silicone, very soft, that you can easily press. So when you press it, you can even tell the amount of food you are giving to the baby. So when the baby finishes that food, you are sure that the baby is well fed.
True.
And then at intervals, purge the baby, rub their back, let them belch. When they belch, then you feed again, because for somebody that is feeding directly, because they get tired easily, they are struggling to suck. So the parent needs to know that when you are feeding for 30 minutes, what the baby has gotten is probably for 15 minutes. Because the baby is even tired. And even
I
when they're
can
taking it in,
imagine.
they might be taking in air. And the baby's stomach is bloated. And in your mind, you feel like the baby is full.
The baby is full, you know.
So when the baby is crying in the next 10 minutes, you're wondering what happened. In fact, the mother might be frustrated. So we want them to know, when you feed for 15 minutes, know that the baby cannot probably do more than that 15 minutes, especially when they're still really small. When they feed for 15 minutes, put them on your shoulder, rub their back. When they belch, put them on the other side of the breast. After all, you're supposed to feed your baby for 1 hour, and they should feed every 2 hours. So let them feed 15 minutes, stop them. When they belch, 15 minutes, 15 minutes again, 15 minutes. With that one, you've been able to express this milk for 30 minutes, or that one for 30 minutes. You are sure your baby has been fed for 1 hour.
1 hour.
And the baby can sleep.
Nice. You
So
see?
there's a lot.
Sincerely, it's a lot. And I really love the fact that you're so passionate about this. You know, I see the energy. I see the passion in your eyes. I see the way you talk about it. And I know that, oh, wow, this woman is really doing an amazing job in this advocacy thing. And people really need to know. And for the benefit of our listeners who are hearing about cleft lip and cleft palate for the first time, you see, you keep hearing that we're talking about it as a baby. Now, I think we need to make people know and be aware that it is a congenital abnormality. That is the reason why it is common with babies. So that's why we keep referring to baby, because children are usually born with this. Like some babies are born with it. So that is the reason why it's more in babies. And but really, at what point can it be corrected? At what point can the baby be taken for surgery to, repair it?
We even in the hospital, we have older patients as an adult that are married that do not know that this thing can be repaired. And they have
and they've been living with it
and
right from
surgery got corrected eventually.
Okay,
we've seen a grandmother that has it and it got corrected. So it can be corrected at any age, but it is important for it to be corrected early because it's going to help the lip. It's going to help the baby in feeding and aesthetics. Some of them go through a lot of bullying. Oh my God.
Self-esteem.
Oh my God. They have low self-esteem.
I know,
some of
right?
them don't want to go out. Some of them don't want to have. They don't have friends. They have psychologically they just
it will definitely affect their mental health.
Do you
because
even know that
they wouldn't even want to look at themselves in the mirror. Sincerely,
that is even about the children. Do you know what the parents go through?
Wow.
When these children are still very little, they don't even know what is going on around them. What is the mother? Parents, most especially mothers, they receive this. Oh my God! Some of them will not even want to bring the children out. They don't want to bring their child out. Some people will wrap the child up. Some people will not be, because the neighbors that are coming around, people from the street that are coming around, are not coming to come and greet you. They just want to come and see the child.
See the child and see what the child looks like. Whether it is an attitude for you,
the story has gone around that there is a child, there's something about the child. So they just want to come and see.
Wow.
And unfortunately,
it's a tough word, though.
A very tough one. And then they say a lot of things to the mother. And the parents keep feeling like, what have I done wrong? Do you understand? Like, what have I actually really done wrong? So at that time, the parents, especially the mother, are at the receiving end. They are traumatized. They are in denial. They are even asking questions. God, why? Why me? After waiting, after being faithful, after this, a lot of questions. Some of them even doubt themselves. Is it true? Maybe I'm not good enough. Maybe I'm not the best. They question themselves.
You know, something just dropped on my mind now, right? When you talked about the fact that sometimes the mothers will be feeling inadequate, like, am I not good enough? What have I done wrong? Something just dropped, and that is postpartum psychosis, postpartum depression. Do you know that this can actually be a trigger for a postpartum depression?
It's not that it is.
Yeah.
It is one of those things.
It is
one of those things. Many of them, I've seen parents that have told me one-on-one, no, you know what? Somebody forced me to come in. As I'm going home now, I want to go and throw this child somewhere.
Jeez.
And we have to come about talking to them. See, at a time, we were focused on the children. But later we discover that the parents, usually the mother, needs to be taken care of. Because as I always say, what you don't have, you can't give. If you are not psychologically sound, you can't take care of your child.
I mean,
there is nothing you can do about it. Even if you are not in the right frame of mind, even if the child is crying, you don't even know what to do. You don't, that care that we're talking about, you can't even give it because you're not in the right frame of mind. So at that time, we try to focus on the parents. We try to talk to the mother. We counsel them. We teach them what to do, how to even respond to people around that are coming to tell them that their child is a taboo. You have to, I will tell you know what?
You know, I
mention my name. Tell them that the nurse said this child is not a bad child. The cause for cleft lip and palate is not known at the moment.
Because it's congenital.
Yes, so a lot of researches are going on.
Yeah.
However, there are some things that can contribute to it.
Okay.
Contributing factors.
Okay.
One of the strongest things is that it can be genetic. Because we have seen parents that have clefts give birth to a child that has clefts. So of course there is a strong
hereditary.
Yes.
Yeah.
Lack of folic acid
in pregnancy.
Yes, in pregnancy can lead to a child born with cleft lip and palate. That's another one.
Pregnant women, can you hear? all those medications they give you at antenatal clinic and you refuse to take them. You know, a lot of pregnant women don't take the medications they give them at antenatal. All the folic acid, all the blood tonic, multivitamins, they'll just hide it under their bag.
Yes, some people have this cleft child as their third child or fourth child or second child. You know, and as a third child, they'll say, I've had one or two before. I know how it is. They don't go to the antenatal clinic until around 6 months.
Because they have experience. You understand? They are not new in the game anymore. It's only primate.
Yes, so you see them collecting drug from their neighbors. I used this when I wasn't feeling fine. You to take it. You know, they tell themselves, use this drug. You can take it, even though they are pregnant. They don't go to the hospital. So all of them, at the end of the day, I know that cleft lip and palate happens between the 6th and the 9th week. When the baby is in utero. So 6 to 9 weeks, some people are not even aware that they're pregnant.
They're pregnant.
So you're doing a lot of things. A lot of things. So if there is lack of folic acid, it can be genetic. Stress can cause it. Radiation can cause it when they're exposed.
Exposure to radiation
can cause it. Alcohol.
In pregnancy.
Yes.
Okay.
Yes, it can cause it. Because in fact, 6 months before you conceive, it is advised that you live a healthy life, eat healthy food, abstain from alcohol.
If you are trying to conceive.
Yes. So 6 months before then, you should even be taking care of yourself as if you're pregnant. Because it is very important. Alcohol, drugs, you know now, the way the drug is going on in this generation at the moment. You know, a lot of things are happening.
Lord.
Drugs, abuse of drugs, you understand? And a whole lot of things. So it's not just about the fact that I'm pregnant or this and that. So now the myth, they will say it's a taboo. They can say it's a reincarnation.
Okay, so wait. Let me start from that. They will say it's a taboo. Doesn't mean that the child itself is the taboo.
Yes. An abomination.
Okay, so this child now, if you are looking at the child, say, oh, this child is a taboo, it's a tofiakwa. So now to go throw away.
You understand?
Hey,
that's what happens.
This one is wala.
So this happens a lot.
Wow.
You know, when somebody is expectant and you have a child like that, people are coming to you that which kind of kid it is? Where did you bring this child from? Some people say that, tell her she must know where she brings this kind of child from. And you know it is always the mothers. Tell her, ask her, where did she go when she was pregnant? She must have fornicated, she must have done this, she must have done that. Then some people say that when you eat snail
in pregnancy,
say the person.
She snail that contains calcium. What's that micronutrient that snail has? Me as I am like this, I like snail, but it's just that it's too expensive. She understand.
What is more expensive than that? So people will even say that when you walk in the hot sun, when you walk at night,
or in the afternoon, like 1 p.m. or 2 p.m. You know, it's in the afternoon, like 1 p.m. or 2 p.m. when the sun is very high. That's where Obanje children used to walk up and down. So if you are pregnant and you now, especially if you go to T junction, you know, so when you now get to that place, Obanje child, you just come and remove the normal baby from the
and then switch.
and then enter inside.
I think that sim swap.
Sense will not kill me.
Too much
We used to watch it inside Hollywood.
Now this African magic which African magic they do us but God Disha. But all of those things, and then some people will just believe that is the reward of evil. So maybe somebody has done something bad, or they can even tell you stories of the forefathers that used to go to war, that used to they will just come up. I know that in this part of the world, we can come up with a lot of stories, even though we don't know what the cause is of. But we will cook it up and we'll give it to them. And they would, unfortunately, people can be very gullible. I'm sorry to say. They will not even know how, but they will just accept it. And in this part of the world, that healthcare, anybody that goes to the hospital now, they just feel like, why are you wasting your time when you can do sharp around the corner, all of those things. So we have to, and then we understand that the cost of all of these things is expensive. In fact, cost of surgery is very expensive. But the good thing is that there's an organization that is sponsoring it for free now, and that is Smile Train Organization. I can say that.
Okay.
So they are sponsoring it, and then they are partnering with, of course, now LUTH, Lagos University Teaching Hospital. So Smile Train is partnering with LUTH, and all of these children are being seen for free.
Wow! So you're telling me now that there is an organization that is ready to sponsor.
They're already sponsoring. It's not about ready to sponsor.
Okay, they're already sponsoring.
Yes.
So if we have a child with cleft lip, cleft palate,
yes,
they can come in,
yes,
and
yes,
get the surgery
yes,
done for free.
Yes, you don't need to have a long leg.
That sounds like good news.
The leg that you have is a long.
Okay, so your leg does not need to be long or short. Your leg should just be normal leg.
You have my contact. You can drop my contact for whoever that you see that has this condition.
Okay.
It is absolutely free.
Absolutely. Wow. Sincerely, that's a good one.
So the surgery, some people even give them food, give them money for transportation, give them food for the kids, because some of them don't even have it. Because the child has to weigh to a particular kg before the surgery can be done. And this is because we want to boost the child's immunity. We want to make sure that the muscles are well grown, so that there won't be a relapse, there won't be a breakdown, all of those things. So the baby needs to be well fed. And then if the mother cannot even afford the food, take care of the child, we are going to be on top of this matter now. Be looking for weight up and down. Have you seen malnourished children? That is the third leading cause to mortality rate. Child mortality in Nigeria at the moment. That's the third.
So does it mean that currently we have more cases? We have a lot of cases of cleft lip and cleft palate.
My sister,
what does the statistic look like?
As of today, 1 or 3 now in 100 children have cleft lip and palate.
Wow.
So it's no more news. It's no more. In fact, I'm sure that if there's a review statistic now as at today, we're going to have it being reviewed, because as at now, it's no more news. It's no more rare. It's no more rare. We have it.
It's no more rare. It's now common.
Yes,
but unfortunately, people are not still very much aware.
Exactly.
That's the problem. And that is the reason why I'm so happy that you're on the show today to give us this. Sincerely, I really love the fact that we have you on the show today, and you are sharing a lot of knowledge with us on the show today, because really there are some things that I didn't know about cleft lip that I have learned right now. So I'd like you to share with us some of the challenges that you've faced so far in this very unique field of advocating for children with cleft lip and cleft palate. So what are the experiences so far? Like, what are the challenges in the experience?
So far, I can say that everywhere that we get to talk about this, people are interested, because they actually do not have so much information about it. So the major challenge is the awareness. It is not out there enough. It's not loud enough. People are not aware. We need to get to more places. We've been to Mowe, we've been to Epe, we've been to Ikodu, we've been to a lot of places. We're going to Badagry very soon. We want to revisit Ikodu, going to places around, just to tell people about this. But we are still not we can't do it all. I think that is one of the reasons why I'm here. And
Yeah.
I believe that a lot of people are listening to this.
Yes, they
And
are.
we still need to get it out there. So I use my social media handles majorly to talk about this, because I believe that there is a lot of engagement on the social media now.
Yeah, of course.
So
yeah.
I just believe that one day somebody will see the message pop up and it will be useful. And that's why I tell people that please share. When I post, I say please share. Not just because I want followers, because I wish for people to know about this, to reach out to people. So for me, I feel like the major challenge is still the fact that we are not able to create this awareness enough. For the for what we have as a statistics at the moment, the awareness is not enough. As a matter of fact, there are some hospitals that are not even aware of this, because we had a patient at the time,
Right, I think.
mother that had a baby, and then the hospital that they gave birth, they were told that they should not feed the baby for about 24 hours or 48 hours.
Why, if I may ask?
Because they believe that the child cannot feed because the baby has cleft lip and palate. So I just felt like they're not aware, because there is nothing stopping that child from feeding like every other child. In fact, breast milk is essential for every child. A child that is born with cleft lip and palate or not, every child needs breast milk. A child that was born and is being starved already, just because you feel like the child has cleft lip and palate and cannot feed, it is just because there is no awareness. Because there is no reason why that child should not feed. No, immediately the baby comes, before we can even say anything, just said this baby has to feed. And the mother was lactating.
So it means that hospital where the baby was born, the professionals there, I mean doctors, nurses, all of them, even the midwife self, no one sabi anything.
They are not aware. They are not aware. We've had this. It's not just what I think, it's what I know. Some people are not aware. Okay,
so we've been able to identify the problem, the challenge of lack of awareness. You know, when you were talking about the challenge, you kept on saying we. So does it mean that, do you have an organization like an NGO where you actually do this awareness thing?
Okay. So I said that earlier, that Smile Train Organization is partnering with some hospitals, in which Lagos University Teaching Hospital is part of them.
Okay.
And Lagos University Teaching Hospital is a tertiary institution in Nigeria and based in Lagos. And the beautiful thing about the LUT Cleft Care team is that it is a comprehensive cleft care. So in Nigeria, LUT has the complete cleft care team. Because from surgeon to the nurses to the nutritionist to the social worker to the psychologist to the speech therapy, so all of those people come together to see that these children have, to the orthodontists, pedodontics, so that they can arrange their teeth, they can aesthetics, you can boost them, all of those things. So all of this is complete as LUS, and that's why I kept saying we, because it's a teamwork.
More like a multidisciplinary approach.
Yes, it is a multidisciplinary approach.
Yeah.
Because when the child comes, we counsel, the nutritionist come in to teach them how to feed, what to feed. The nurses counsel, teach them on the sitting position what to do. We monitor their growth. When they have the desired weight, then they are scheduled for surgery. The surgeons come in, and before they are scheduled, of course, the surgeon would have seen also to monitor. The orthodontists, they have what to do. They have their own part, and then by the time they are done, when the child grows to a particular age, the speech therapists come in, which I'm also a part of the speech therapy team. And then so the speech therapy come in when they grow more, and then their teeth are not well arranged. Orthodontists come in again to arrange the teeth. Then they visit the pedodontist to see that their teeth are going well. During this time, the anesthesia people, that are there, anesthesiologists. I don't want my tongue to twist actually. So they are there. So while the surgery is going on, a lot of people are involved. After the surgery, a lot of people are involved, because we discovered that it is not just enough to repair. A lot of people still have the speech defect, and they don't get to talk to people. They withdraw, because they will ask them, why are you talking like this? They tend to talk through the nose because of the palate. Because normally when the speech is going on, there's supposed to be a closure at the soft palate to close down. So
Yes.
when that happens, there is a space. There is the palate is open, so air is coming in and out freely. So when they talk, it looks like it's going through the nose,
Through
and
the
then
nose.
it's like, you'll be asking, why are you talking that way? Many of them withdraw.
And they don't
Go back
want to
into their shell.
talk.
In fact, if you see many of them, they say they are introvert, and it's not like that. It's just because they learn not to talk to people. So the children, when we now get to see the ones that are younger, then they are coming up, we have a lot of psychosocial activities for them. Like tomorrow, there's going to be Children's Day celebration,
Yes.
outdoor game. We have our speech camps. We have talent shows. We make them, even for the adults. We have adults from 16 upward. We have psychosocial meetings with them. That was the last time we had dinner. So that they can go out. Many of them don't go out. We try to talk to some people to make friends. They don't want to, because they don't want people to talk. Why are you like that? And you know that our people, now they can say some things sensitive without being, as in, they'll just say it as if this,
So some people don't even put another person's mental health into consideration. Like they are so
it's
sincerely
bad. It's actually bad. It's very bad. So we see a lot of them that are not socializing, and that's not good, because when you isolate yourself for so long, then you're already giving you room for depression.
True.
And one of the things that affects adolescents at this time, researchers has even said that it is the feel of no genuine relationship. So that's what drags them to depression.
The feel of no genuine relationship.
Yes. So when they feel like nobody wants me, nobody likes me, they are not my friend, they don't want to be my friend, all of those things, they withdraw. There's tendency for them to isolate themselves. When they isolate, they think a lot, they do a lot of things, they go gradually.
Depression can even set in, and then suicidal thoughts.
After depression, what else?
Wow.
So we do all of those things to make sure that they feel included. So we are trying to, we are also advocating inclusion. Get them to work. Why will you not employ somebody that is? And from what we have now, the children, they're doing very well in school. You need to see their report card. They're doing well. And because we now engage them in these psychosocial activities, many of them now take roles in schools. They sing, they dance, they do poems, they involve in dramas. And before, they don't want to do those things because they don't want them to be seen. A lot is going on. So what we're just saying is that children that are born with cleft lip and palate can live a normal life.
They can still live a normal life.
Yes, because
like
they're normal
every
children anyway. They're normal.
True. And I think I really love that part where you left it off, that children who are born with cleft lip and cleft palate can live a normal life just like every other children. One of the things I love about today's episode of Healthcare Achievers is not just about us bringing you to talk about your story. Like you've told us about your story so far, how you got to where you are today, but the show has become an episode of many parts now. On today's episode, we've shared your story, and we've talked extensively about cleft lip and cleft palate, which is a whole lot of advocacy on this episode. And then I would also say that this episode has also given a good awareness to pregnant women.
Yes.
Very important.
Yes.
Pregnant women, like things that pregnant women should do and should not do. Like when you were talking about the fact that even someone who is looking to getting pregnant, in 6 months before pregnancy should start acting like you are pregnant.
Yes.
So the healthy habits you would want to imbibe in pregnancy, you should even start.
Now,
So I think this is really a very good eye-opener for women and all that. And I would love to really encourage women that no matter what, just keep strong, because I know women, like we said earlier, women are usually at the receiving, most times are usually at the receiving end. Nobody looks at the man when a child is born with cleft lip. I mean, it's really something. It's an African thing, it's a Nigerian thing. So on this note, I would like you to give your words of advice to the groups of people that you would love to talk to. Young people, pregnant women in general, or people who are currently living with cleft lip and they don't know what to do. just a final word of
Okay, so I'm going to
admonition.
start off by saying that you should know, everybody should know that cleft lip and palate, children that are born with cleft lip and palate is not peculiar to a certain social economic status. So it's not about it's only for the rich, or it's only
for the poor,
or just anybody.
And I think I've heard that as a myth before.
Yes.
That it's only for the poor.
Okay.
Yes.
So now it is not. It is a myth that we have to rule out.
True.
In fact, so anybody, anyone, absolutely anybody can have a child that is born with cleft lip and palate. I think we have to get that one first.
True.
Knowing that, so you're going to. So what can I do? After all, there is no particular cause, so that you don't even know what particularly you are to avoid not to have a child that is born with cleft lip and palate. So, what are you supposed to do? Live a healthy life. I usually say that to live a healthy life is not so expensive. Except you want to just go out of the way or do what you cannot.
Help me tell them more. And they always talk more.
Yes, because after today, a bottle of soft drink is 400 naira.
No, there are some brands that are being sold for 500.
Okay, at least the
minimum.
Medium,
is 400.
400 naira, right? So now that 400 naira can get you a slice of pineapple and a slice of watermelon. Imagine 2 fruits. So why don't, and then a bottle of water is just 200 naira. So you can do a bottle of water and then apple. Apple is for the wealthy now. Okay, I get. But pineapple, watermelon, banana is for the rich. I understand. But what about every other fruit?
Yeah.
So, and even for the children that are going to school.
Even when fruits are in season, they are cheaper.
They are cheaper.
So I always tell people to explore fruits that are in season. When a fruit is in season, in fact, from January to December, there will always be a fruit in season.
A particular fruit is always in season.
Exactly.
Now, mango is trending. So let's do mango. So I just want to say that we should live a healthy life.
Yeah.
Eat fruits. Take a lot of water. You can do exercises as minimum as you can. In fact, as the list of walking, as if it's just to walk, some 30 minutes walk, that's good. Do away with drugs. After all, it's not even about the child now. Even for you, it's not even healthy for you. So why?
And substance abuse is a thing now.
It's a thing now. It's a thing. And most of the things that the major reason for it is even peer pressure. I don't understand. So that you can feel like you belong. Then pregnant women. This thing about when I'm pregnant, I feel like taking. There was one of the people that we saw that said that she usually sits by the gutter and then sniffs those terrible odors that are coming from. I don't get.
Tell me that's a craving, like a pregnancy craving.
Is that one? I don't understand. What kind of a craving is that? There's some things.
Wow, so that's
some things.
I'm hearing this one for the first time.
I know.
I've heard about a lot of pregnancy craving, like weird craving, but this one, this sniffing of gutter smell.
Yes. You just want to sit down by the gutter and be sniffing. I don't understand. It's not even healthy for you. Not talk of healthy for the people. So simply living a healthy life. Live a life that when you look back at it, you are even proud of it.
Sure.
Just live a healthy life. For me, living a healthy life is not expensive actually. You can afford to do it the same way you would do every other thing. Just live healthy. With that in check, then take folic acid. Even as a woman that is believing to get married and give birth, folic acid doesn't hurt. It is just a tiny tablet. Take once a day to prepare yourself, prepare your system, and then you're good. You can do that. Eat healthy food. It doesn't have to be junk up every time. You can do well-cooked meal and eat. And then, as much as possible, avoid some sort of radiation because now, all of us carry laptops everywhere.
Yeah.
Even this room, a lot of radiations. But as much as you can, try to avoid, as in just move around after leaving. As in, your laptop doesn't have to be on your lap every night. Just as much as you can, just reduce some sort of radiation. Some people live near a mast.
Yes.
All of those things. There can be a contributing factor. It doesn't mean that it is exactly what is causing it.
Yeah.
The genetic part of it is almost, there is almost nothing you can do about it.
Of course, that's intrinsic.
Yeah. And also the folic acid, I just think that with the folic acid in check, going to the antenatal clinic during pregnancy, you don't have to go and meet your neighbor to give you the drug that she took during her time. It might not work for you. Then we also have, and also this advocacy goes to the TBAs. We cannot we cannot say that they are not existing. No.
That's traditional birth attendants.
Yes, the traditional birth attendants. We cannot say that they are not existing. They are existing.
They are existing.
The truth is that some people even trust them more
than they trust nurses in the hospital.
And doctors.
True.
Well, that's why we're trying to talk to ourselves that we should be more receptive in the hospitals. We should be more receptive. We know that brain drain can affect us, but we should be more receptive. But the truth is that they believe those traditional birth attendants even more than us. So even when we do our outreaches, we want to reach out to them too. If you see children that are born with cleft lip and palate, please don't say that, because of their beliefs too. You don't say that it is this and that. Please refer them to
the hospital.
It is free. You don't need to have a long leg. The leg you have is already is enough to carry you to lose. And then you will be sane. So we advocate all of this to everybody that needs to know that cleft lip and palate is not a disease. Well, it is a repairable condition, a congenital condition that is repairable. It is not a cause. It is not a taboo. And most of all, it is repairable. And a child that is born with cleft lip and palate can live their life to the fullest. They can live like every other person. And then please, we have to stop the bullying.
And the stigma.
The stigma. It is really bad. So this inclusion has to come in. If you see people that have cleft lip and palate, it's not contagious. It's not when you shake them, you can't contact it. So please, if somebody needs an employment and you have the capacity, employ them.
And if the person is good,
why not?
Why won't you employ?
So a lot of things are happening to them.
It's a lot of discrimination.
I just feel like all of these things, and of course, maybe because we don't know, that's why we are here. Cleft lip and palate is repairable, and it can be done for free.
Thank you so much. Thank you so much for coming on the show. It's one thing for somebody to have fine face. There's another thing for somebody to have fine brain. Sure, you understand?
I'm swept off my feet.
Yes, so you are the kind of woman who say beauty check, brain check, passion check, confidence check. Do you want me to continue?
It's okay. Thank you very much.
All right.
Thank you for having me.
It's a pleasure. It's been nice having you here. All right. So you already have it, people. That's it for today. Cleft lip, cleft palate, everything, all joy. Pregnant women, go and register for antenatal. Go and register. The midwives are expecting you. Nurses and doctors are expecting you in the hospital. Don't just assume that you're okay. A lot can be happening in your body system that you don't know of until it starts giving you sign. And it might not even give you sign and it affects the baby. And then when you have that child, the child now comes out with a congenital abnormality like cleft lip and cleft palate. And then you say, see the child is saying, So we really want to, and we'll continue with the advocacy.
Everybody must hear about this. We must move. We move.
Yes, so everybody must hear about it. This knowledge, this advocacy go touch everybody.
It must touch everybody.
It must go around.
Everybody must collect.
Amen. All right, so meet me here again for another interesting episode of Healthcare Achievers Talk Show, as I will be bringing another achiever of the week for next week that will be sharing our story or his story with us. So my name remains Mary Zureya, aka Raya the Radio Diva, the queen of microphone, the one and only media nurse. Any other is a counterfeit. I love you all. Keep listening.